A warm welcome to one and all. Today we will be discussing regarding osteoporosis nursing perspectives. In this topic we will be discussing regarding its definition, types and the causes and risk factors, pathophysiology, diagnostic evaluations, the management, complications and the preventive methods. So, osteoporosis is a silent disease which will be because of bone mass lost over many years with the no signs and symptoms. It's a silent disease. Slowly it will start and it will affect the bone mass and the bone density, which will be decreasing. There will be decreased calcium absorption, otherwise there will be the increased excretion of calcium from the bone, which will be slowly leads to a fracture. Definition says thinning of bone with the reduction in bone mass due to depletion of calcium and bone protein. That means there will be decreased absorption of calcium into the trabecular bone, otherwise there will be bone protein which will be decreasing in nature, otherwise it will be excreted out in increased amount. So, there are mainly two types of osteoporosis, primary and secondary. In primary again we have two types, that is type 1 and type 2. Primary osteoporosis, normally it is because of aging process. It slowly happens as the age is advances. So, in type 1 we have increased bone reabsorption. The turnover will be decreased, whereas the bone reabsorption will not be will be increased, where the increased amount of calcium is required for the reabsorption of the bone. Whereas the osteoblast and osteoclast cells, we can see osteoclast cells, they will help in the breaking down of the bone, whereas osteoblast cells, they will help in growing the new bone. Okay, so estrogen level in women will lead to osteoclast, that is because of the osteoclast cell, means there will be increase in the breaking down of the bone, whereas there will not be any further growth of the bone, is not happening. Because of that, the bone will be very fragile in nature. Testosterone in men, that is related to increased bone mass density or bone density, the level will be decreasing. The protein which is present in the bone will be excreted out increasingly. So, that is because of testosterone decreases, the bone risk for osteoporosis is increasing. Then we have type 2 in primary, that is called senile, which will be like a long term calcium and vitamin D deficiency. This is because of lack of intake of calcium or vitamin D in diet, maybe because of decreased exposure to the sunlight, which is resulting in poor vitamin D. Calcium in the sense because of either the person is having a intolerance towards the calcium, or the person is not consuming calcium adequately in their diet. Some people will have intolerance towards the lactose, they will not be consuming milk and milk products. Okay, so in such condition, other things are like thinning of compact and trabecular bone, there will not be adequate mass or adequate density of bone, may not be maintained by birth, or it is because of family history. Hyperparathyroidism is a condition where there will be increased production of parathyroid hormone, which will be resulting in increased excretion of calcium from the bone. The amount of calcium also will be excreted more in number. We have secondary causes osteoporosis. In this we have hyperparathyroidism, again same thing, and we have diabetes. Osteoblast cells will be increasingly they will be having a problem with the osteoblast cells. There will be proper maintenance of osteoclast, there will be breaking down will be happening, but there will not be any further growth of the bone, turnover will be decreased. Corticosteroids are the drugs, steroid drugs, which will be taken for a longer duration, which will affect the osteoclast cells, because there will be growth of the bone, but there will not be any breaking down of the bone will not be found. Thalassemia is the condition where the bone will be undergoing thinning, it can be trabecular bone. Multiple myeloma will be having an imbalance between osteoblast and clast process, where will be breaking down and regrowth will be disturbed. Intestinal malabsorption, this can be because of a part of the intestine can be removed, or anastomosis can be done in some intestinal diseases or CA intestine, where the absorption rate of calcium and vitamin D also decreases. And we have some disease conditions like leukemia, liver disease, Marfan syndrome, acromegaly, Cushing syndrome and scurvy. So some cases there will be demineralization of the bone, no adequate mineralization, or there will be imbalance in growth and breaking down of the bone. Acromegaly is the condition where we can see hypercalciuria, where the increased output of calcium is seen through urine. And Cushing syndrome, the density or the mass of the bone will be decreased, and scurvy is the disease condition. There will be again the density or the mass or the protein in the bone will be getting decreased, or absorption rate will be decreasing. Certain medications like antacids containing aluminum or this will be having decreased phosphate absorption level in the bone, that will result in poor calcium absorption. And heparin is the other drug, methotrexate, anticonvulsants, Lasix, thyroid hormone, steroid, cortisone therapy. These drugs, if it is consumed for a longer duration, like it can be taken for chronic illness, or it can be taken for a longer time, then that will result in there will be imbalance between these two cells called osteoclast and osteoblast cells, where the turnover of the bone may not be happening in a proper way or proper time. Other risk factors, the risk factors we have divided into two groups, like modifiable, which can be modifiable, like which we can change. Some are like non-modifiable risk factor which may not be changing, like they will remain same for a long duration, or they will remain same. Like diet and lifestyle. Diet, we can add more calcium or vitamin D in our diet and we can improve our condition, especially above 40 years. We can now start taking high calcium diet, or we can add calcium supplementaries in our daily routine. Also we can start doing exercises or light walk or do meditation, yoga therapies. We can slowly start to make our body active, keep our bones stronger and active, so that we may not fall for a risk of osteoporosis. These are the some non-modifiable factors like age, gender, highly seen in female because of attaining menopause at the age of 40-45 years, where we can see decreased estrogen level in our in the female. And race, like white Asian descent people are at high risk to get osteoporosis. Body frames, short people are more risk comparing with the tall ones. And family history, like it will transmit from one generation to another in case there is a history of osteoporosis in the family. Some medical conditions like celiac disease, gluten intolerance, the person who is having gluten intolerance will not be able to absorb the nutrients in the gut. Okay, so there will be malabsorption, there will not be adequate absorption. So whereas calcium also will not be getting absorbed properly in the intestine. So inflammatory bowel diseases, corticosteroids, low bone mineralization will be found, as I told you earlier. So they will not be maintaining a proper bone density. Women that is having a cancer of breast will be at high risk to have decreased estrogen level in her body, and men with the cancer of prostate will be having decreased testosterone level. And GI surgeries, as I already told you, intestinal surgeries where the part of the intestine will be removed, especially CA intestine. And pathophysiology says normally because estrogen regulates on the osteoclast cells which breaks down the bone, and progesterone controls the osteoblast cells, which will be helping in growing a new bone. So this is the normal process, this is how it works. But here, due to etiological and risk factors, what happens is, because of these many reasons of disease conditions or taking excessive medications, because of these things, what happens, bone turnover is not regulated, it is not happening properly. This breaking down of old bone and growth of a new cells in the bone is not happening properly, resulting osteoporosis, decreased density or mass, decreased mass in the bone, which will be a weak or a fragile bone, which will have a high risk for easily breaking down or having a risk for fracture. So it easily breaks down in the sense a small sneeze or a small fall or just coughing can result in breaking down of the bone. This is is why we say it as a silent disease. It's not happens overnight. It takes time. Slowly the things happens in our body, like bone undergoes this process, and finally one day there will be a break. So there will be decreased bone strength lead to an increased risk for fracture. These are the some clinical features, like we can see height lost and back pain, stooped posture, bone fracture without major trauma, bone or joint pain. So these are the patients usually will come with the complaint of a fracture to the OPD. Otherwise they will be having a abnormal posture because of the fragile or weak bone, which will be changing their size of the bone. There will be change in the shape of the bone because of a weak or a decreased mass or density of the bone. Some people will come with the major fracture, some people will just have a crack in their bone. So these are the common signs and symptoms which we can see. The complication of osteoporosis is there will be especially seen in spine or hip bone. Commonly these are the two bones having a problem. Either there will be a crack or there will be a fracture. Otherwise in some terms there will be a dislocation. In some cases a spiral fracture can result in back pain, loss of height, and hunched forward posture. There will be like a stooped posture will be found. So these are the some complications where the bone will have a break, complete dislocation, can be a complete or partial fracture. It can be a spiral fracture. That's how the mortality rate will increase. Bone and bone related diseases, and a decreased quality of life, because patient will be always depending upon hormone therapy or immune therapy. Patient will be depending on medication, whereas their lifestyle it will affect, or the quality of life will be getting affected. So these are some diagnostic evaluations, like we can collect the history of the patient and we can identify like whether in their family they have osteoporosis and what is their age, if it is advancing age is causing osteoporosis, or they also suffer with some disease conditions like DM, diabetes mellitus, they will be having CA, or they have undergone any surgeries, or they are taking medication for a longer period. These are the some things which will lead to osteoporosis. And you also can do a physical examination or a musculoskeletal system assessment to find out the clinical features and find out where exactly the problem is. Like you can ask for pain, you can ask for a fracture, you can ask for past history of fracture. Okay, so these are the things, some other physical examination which we can do. X-ray of to find out the fracture exact location where it is, find out which bone is got affected and what type of fracture it is. MRI we will be doing to identify if there is a damage to the blood vessels, bone marrow or bone mass, the level of density. So these are the things will be identified by because of MRI. And CT scan we can do and find out the structure and the tissue damage in the affected area or surrounding areas. Blood test, in that we can identify the level of alkaline phosphate and calcium, whether it is adequately present or not, or if there is a increased loss of calcium during the certain period we can identify. X-ray DEXA will be helpful to identify bone density level. And these are some of the preventions. We can ask the patient to do regular exercise, eat healthy diet, include calcium in diet, include vitamin D in their diet, or we can ask the patient to take vitamins as they advance in age, and they can consult a doctor signs and symptoms when it appears, so that we can avoid a fracture. So talking about management, we have a medical therapy where we will be providing with the medications. We have drug therapy. In this we have bisphosphonates. The drug is alendronate will be provided. This will slow down the process of fracture or the osteoporosis. So we will have adequate time so that we can treat with other medications, or we can provide some supplementary vitamins and calcium, so that we can make the bone strong enough. So the bisphosphonate are the drugs which will slow down the progress of osteoporosis. Then we have something called estrogen and agonist and antagonist, which is the drug is raloxifene, or Evista is the trade name, where we can give this and we can increase the level of estrogen level in a patient who already attained or going to attain menopause. Calcitonin is Calcmar, and miacalcin is the drug which is a calcium supplementary, increase the calcium in our body. Parathyroid hormone, in case of parathyroid problems we can administer. Teriparatide or Forteo is the drug of choice which can regulate the parathyroid hormones. rank-ligand rankle inhibitors is a Dsouza is a drug, is a immune therapy, so that it will boost the immunity and it prevents with the inflammatory disease conditions patients with the osteoporosis. And we have some medical management related to diet and lifestyle, where we can administer more calcium through the diet to the patient by with the, like these are the some examples for calcium rich diet: milk, cheese, yogurt, milk and milk products, and green leafy vegetables such as broccoli, fish with the soft bone, especially fish, saltwater fish, which will be having a high amount of calcium in it, and such as like a tin salmon and a tuna fortified. And we also have moderate, also have to do moderate and regular exercise and exposed to sunlight, that is early morning sunlight, and in the late evenings we can expose the patient. Stop alcohol intake, stop the tobacco intake, and stop smoking, and exercise regularly, do yoga or do meditations. This is the surgical option we have, that is called the kyphoplasty. In kyphoplasty, what we do is we insert a needle into vertebra, and we will have a balloon which is attached to the tip of it, and we will be inflating the balloon once it is in a proper position. And that's how that balloon will create a lot of space, because the spongy tissues move, it will push to the corners, and we will have adequate space because there is a osteoporosis. And in that space we will be administering a solution of a cement, will be turns into a hard particle which will give us strength for the bone. That's how we can prevent bone fracture, especially in a vertebrae. We have vertebroplasty, which will be correcting a crack in the bone, which we will be applying the cement, and we will be filling the gaps, and we will be providing a stronger bone. And we have a hip replacement surgery, where we will be replacing the hip joint. Here it is intratrochandular joint, where there will be a replacement of a ball and socket joint, you can see in picture. And we have some other implants which will also help us in the correction of the fracture or dislocation or a crack. Like for example, we can administer rods, we can administer plates and screws to fix the fracture or dislocations. Nursing diagnosis. In nursing diagnosis related to osteoporosis, we have related to acute pain, impaired physical mobility, self-care deficit, imbalanced nutrition, less than body requirement. All these things are related to osteoporosis, otherwise fracture, because osteoporous patients will be having high risk for a fracture or a dislocation. We have some risk nursing diagnoses for impaired skin integrity, for injury, for constipation related to immobility, and deficient knowledge regarding osteoporosis. So we can provide a good skin integrity, we can prevent them from falling. We will see that in nursing management. And there will be deficient knowledge, we can provide them adequate knowledge with why osteoporosis is happening, what is the reason behind that, why hormones are very important in osteoporosis. Then comes nursing management, free from hazards. Usually we can see this happens in adulthood, where especially once the patient is attaining the menopause, or a person is having decreased testosterone level in their body. We can do a vision test for a people advancing in age, so that they will not have a risk for falls. Non-slippery bathrooms we can provide, again same thing, we can prevent them from a fall. Plenty of light in the room or home we can provide, so they can visualize, they will not hit on a sharp objects or something like that. A light walk which can help them to maintain active, and strength of the bone can be maintained. Medication must be reviewed, whatever medications they are taking. Along with that, we can add vitamin D and calcium. We can start with the small dose, and we can increase the dose as per the requirement. Then comes a diet that will be protein rich and calcium and vitamin D rich diet we can provide to the patients. We have to modify their lifestyle, as I told you before. We can stop smoking, alcohol intake and tobacco, limit the carbonated beverages in their routine, take prescribed medication as instructed, take it in a proper time, and monitor whether they are taking it properly, whether they are taking proper dose, or what form of medications they are taking and how long they are taking. So these are the things can be monitored. Talking about the research study, one study I have found that is regarding stem cell therapy. Stem cell therapy was administered to a mice, and it shows that in 2005 it was done, and it shows that it reversed the osteoporosis. I found another study which says that growth hormone along with the vitamin D is a combination which reduced the risk for fracture with the clients with the osteoporosis. I also found another research in which it says that soya protein and isoflavones which will be administered in combination which protected osteoporosis during the menopause. The women at menopause or just before the menopause administering this combination is given more strength towards prevent the osteoporosis among them. So these are the some research studies regarding my topic osteoporosis, and these are the some references which I have gone through and gathered information for this content. And so far we have discussed regarding the definition, the risk factors, the pathophysiology, the causes, and we also discussed the clinical features, symptoms, the complications, how to prevent the complications, and we discussed the management in 3 segments like medical management, how to do it with the drugs and the modifying lifestyle, and we also discussed regarding some surgeries, and we discussed regarding some nursing diagnosis and its management. I hope this video will be helpful for you all, and thank you so much.